how do parents navigate emotions of siblings in this process of dealing with their kids with ADHD and autism?
So I can pretty much tell you, I could go from my experience how I navigated dealing with having a child with autism. So it is difficult. There's no easy way. I know when I was going through it, we did it as a family. I think the possibility of succeeding is when you get the whole family together and we're kind of all in on this. So we had a family meeting, and then my husband and I, we told the children. They were really little, because a lot of times you notice these symptoms when the kids are little. So they're little, they're like 3. My son and the twin sister, they're 3, and my other child 4.5 years old. So myself, my husband, and all 3 of them, we sit down, and then I had learned from one of the staff at the hospital I was working. I think she's a dietitian, and she had a child that has, special issues. And I was always talking about my son. So she told me the family meeting, what she had in the meeting with her kids. So I decided to use that language. So, and this is how she did it. She sat them all down and she said, think of this. We are in the ocean, and both of you, like my 2 kids, I said, both of you, you have life jackets on. And my son here, Chris, he has this iron anchor around him, pulling him down. I said, who do you who do you think that I should help? Do you think I should help both you guys, or do you think we should help Chris? And they said we should help Chris. So I said, that's what's going on here. I said, he has something going on with him. And we all, not just me and daddy, but we all have to focus on helping him. Think of him drowning. I say, you guys are doing well, but we all have to focus on helping him. And I said, you guys, all of us are going to do it together. You guys are going to help as well. So even though they were 3, 4.5, they kind of got it that we all are in this together, because I think that the chances of success is better when you do it as a family as opposed to doing it as an individual. But I can't say I got it perfect myself, because I remember to this day my son's twin sister, because with autism and ADHD, especially autism, you're going to ABA, speech, OT. A lot of times, if they start at 3, early intervention. So you're constantly on the go. And I remember, and then you have to teach when they come home. So you're doing that. And I remember one day his twin sister looked at me and said, Mommy, I want autism too. And then I said, oh, no, 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 you don't want autism. You don't want autism. I said, so I had to really restructure again to try to make that they don't feel left out, because it can definitely consume you. So I can't say I got it, perfect all the time. It's a work in progress, and just do the best you can. Try to just navigate it. It's not easy, but it can be done. Just you just have to trust yourself. I have to just trust myself and try to get the family involved, and try to get them to just keep going.
Okay.
So
So you
hopefully
feel,
that was helpful. But yeah.
yeah, so you feel that even though they're young, it's still important to teach complex concepts to the young children, so you plant the seed. And then did you find that once you went that route and planted the seed, was it a lot of like reminding of the concept because they're young, that it takes more applications of
Yes.
re-explaining to get it to go?
Yes, it was constantly reminding, but I have them helping as well. So they would help, like we try to, because he was nonverbal, so we try to help with play, help them to play well, to get him involved, try to get him involved in play, try to get him involved in speaking, give them the flashcards, try to get him. So I try to get them involved so it will be fun, and not me just sitting down by myself and then them feeling like they're neglected, because I'm here trying to teach him, trying to do oral motor exercises for for speech and all that. So I try to get them and kind of make a game. I remember the speech therapist gave me this. She said to get like a little napkin, and we're going to work on lip, being able to purse the lip in order to say, that helped with speech. So I would get the napkin, and I'll get, practice with him, and I'll get the siblings to also, because they thought it was fun. So I got them to start doing that with him, and they say, Chris, come do it, so they really try to motivate him, and they thought it was fun. So even though they were helping, it didn't seem like to them as if they were helping. It seemed to me like they were just teachers then and playing. So they were more open to it that way. So I really, and I think as parents, you just have to find what works for your family. You know your child very well, your children very well. You just have to try to see what works for them.
Okay. Okay. Perfect. Perfect. Um, Next question we had was, do you have any tips for parents when their kid is going through an emotional blow up?
Yeah, that's a tough one because we had a lot of blow-ups. So I approach autism this way. It's not like, for me, it's not like diabetes where you say, here, take this pill, or hypertension where you say, here, take this pill. You see the symptom, they're getting angry, they're just out of control. And even though it looks, you see the symptom and it might be similar, the symptom is similar for a lot of kids, the etiology may be different. So it's not like you could just say, okay, you're having a blow up, do this. Um, I believe that when I was in med school back in the 90s, I remember that this is one thing that's all stands out to me. It says listen to the patient, and most likely you'll get the diagnosis by the time you finish talking to the patient. And I think for autism that rings so true because I really try to listen with the questionnaires that I give the patient to fill out, and then listening to how they talk. So if they're telling me about a blow up, I try to think about everything that surrounds it, because for some people it could be sleep issues. They could maybe not sleeping well, they're tired, because during the night when you're sleeping with all the melatonin, that's where you have your lymphatics, where your brain kind of cleans itself, nourishes itself, and heal. So if that process is taking place, then of course in the daytime you probably have um, a lot of those blow ups. So I'll find out, how is the child sleeping? If they're having that issue, does the blow up occur? Then I kind of try to link the two together. I'll go through the diet, okay, because sometimes gluten, dairy, soy, red dyes, yellow dyes, all the different dyes, preservatives. I mean, all these things can be an issue that can affect behavior. So I'll go through all that. I'll change I'll change all the diet, change all those things, and then I'll see, okay, I change all those things. Do you see any improvement? Then I'll go into, okay, constipation. I mean, are they having regular bowel movements? Because if they're constipated, and especially if they're nonverbal, and even children that are verbal, they can tell you. So you'll find that you'll see the behaviors come out, because sometimes they're reabsorbing toxins. So I'll go through that. And so we'll go through diet, we'll go through sleep, we'll go through their bowel movement. Sometimes even children having parasites. If they have parasites, sometimes that can cause behavior issues. So I'll go through, okay, I find that with parasites, there's a lot of parasites activity. And I'm finding a lot of children these days, it's unbelievable that their stool cultures come back positive for all sorts of worms, pinworms, roundworm, tapeworms, Entamoeba histolytica, all these things I'm seeing in the stool these days. So sometimes they have parasites, and you'll notice that during the lunar cycle, the full moon, when there's a lot of activities for the parasites, you'll find the behavior sometimes it's worse around that time. So if you kind of get what I'm trying to say, I have to really, really study, listen, and get a good history, because if I can get a good history, a lot of times I can figure out what the trigger is. But it's not, even though the behavior looks the same, but the etiology or the cause is different a lot of times for children. And sometimes I'll try to do stuff, supplements to help while we're trying to figure it out. So you can do things like saffron, like phosphatidylserine, GABA, L-theanine, all these herbs you can use, even magnesium, Epsom salt bath with baking soda. So I'll do all these, even just essential oils with massages. So I'll try to, while I'm working it out, I'll try to find things to alleviate the symptoms or help with the symptoms while I'm trying to work on etiology. That's a long answer, but
No, no, makes sense. So really what you're saying is there's a couple factors going on. The parents obviously in the moment are dealing with the blow up, so they're trying to figure out, what do I do at this moment to help curb it if you can, but then simultaneously they need to have the wherewithal almost to be taking notes and then bring you the information on, okay,
right,
what was happening
right,
up to that point so that they can fix the root part of it over
right.
time. And then while the blow up is going on, is it just a matter of learning to be patient with the process? Like, do they let the kid just, get their emotions out? Do they want to like
Um,
say anything to them, or what
yeah.
would they do in the
Well,
moment while they're taking notes?
I think treating autism takes a team and not just one person. So I like to know that behavioral therapy, speech therapy, occupational therapy. When I was dealing with my son, his teacher, he was going to the special needs school, but the teacher that he had, she had a degree in special ed, special needs. So she was really helpful in giving exercises, calming exercises like deep breathing. And if you think about the classroom with you have 5, 6 special needs children there, sometimes you do have one child that will blow up and you have 5 other kids in the class. So you can't, if one blow up and you don't get it under control, then you'll have everybody out there. So I know, like, even in the house, getting like a quiet area, like even a little tent, and they know, okay, when I feel, stressed, I can't control myself, there's this, I could go into my quiet space until I can calm myself down and I could come back out again. So having that quiet space that they could run to and just teach it breathing exercises, and just getting a good therapist or teacher that can teach. And it's good to be consistent. So the same thing that happened at school, the same thing happens at home, to kind of work through some technique that works for that child whenever they feel angry or stressed or have a blowout, that they calm themselves down. So that is also important. So it's not just biomedically. It takes a team approach.
Okay, so the parent, they need to be proactive in learning from either the ABA or the occupational or whichever. They need to get some calming
Yes.
techniques from them to use in that situation so they can set up a routine so that when this happens, we're going to try these different tools to mitigate what's happening at that
Yes.
point. Okay,
Exactly. Yes.
okay. All right, perfect, perfect. Okay, so next question. Why is there an outside stigma where people feel that children need to be medicated?
I think it's just not, I think that, well, if I can, I always think back to myself, myself, and when I went through it. A lot of, because even when I tried to get my son in a school for that they deal with children with special needs autism, and they told me that I was working on diet at the time, trying to see if that will help with behavior and everything. And at that particular school, they told me that he could not attend if I was doing all these other things, because based on what they know, on based on what they told me, the research that they have, the only thing that is approved to be used for behavior control in autism was things like risperidone and things like, some SSRIs and all these other medication that is approved and studied, like clonidine and all these things for use in autism. So because that's what they were familiar with, um, most doctors, they will recommend you what the studies are showing. But so I think that's why, and then that's what the patients hear. And and a lot of times when you start using medications, sometimes you'll get that immediate just calming effect. So they want that immediate quick response. Although I have to say that with some kids, they go from medication to medication, they still have to work through to find what works for them. But there's a lot of parents don't know, if you go on PubMed, there are a lot of herbs that they have tried for autism and ADHD that have worked and that I have used in children and have worked. And diet is a big factor. I mean, I have kids, when I cut out the red dye, cut out the preservatives, a lot of the processed food, cut out gluten, cut out dairy, I see drastic improvement before I even do any testing and start any supplements. You see drastic improvement. And sometimes for seeing just giving a multivitamin without, they have multivitamins that they've made, different companies just for autism and ADHD, and they have a ton of different things like magnesium, zinc, all these things that go into the vitamin C that goes into even forming neurotransmitters, probiotic, and all these things that you start seeing improvement in behaviors. So I think it's just the lack of probably experience on the parents' part, or sometimes the providers, and lack of information, I guess. I'm not sure why there's a stigma around doing supplements, herbal supplements, and diet as opposed to going right to medication.
No, that makes sense. I think a lot of, medical doctors maybe, and I could be wrong, just because that's their scope of expertise and they lean on their scope of expertise and maybe haven't researched what you've done. So they tend to stay with what they're knowledgeable at. So maybe, there's a little rub there on, who has the right information. But obviously you know both sides of the equation.
I
So
do know
you
both
see it
sides.
you see it differently.
Yeah, and I have to say that the only reason I know all this information is because I had the problem. So I had
Yeah.
the problem, I had to find the solution. And my personal experience just from working in a hospital for 20 years, I know that when I see kids come in with a ton of medications, 4, 5, 6 medications, they've gained a lot of weight and they just keep adding medication. That never seemed to solve the problem. So I tried to find something different for my son because I didn't want that. So I went to PubMed myself, and all these things that I do, I mean, I see maybe they're not randomized, double-blind, placebo-controlled studies, but they're case control studies, they're surveys, and all these things. And I just go on that and look at these studies. They talk about magnesium, they talk about, you know, gluten in the diet, and casein, and soy, and gluteomorphin, caseomorphin, soy morphin, and all these other things. And I started implementing them in my own son, and I saw improvement. And then when parents approached me with their kids with ADHD, and I started implementing the same concept, and I see, wow. I mean, even the parents tell me, man, when I cut dairy out, it's like a night and day, a totally different person. And sometimes even the children start recognizing that. That's when I realized, oh, this is definitely something. And then look in the PubMed, look at the literature, and I see a lot of case studies and studies looking at different supplements and different herbs. And I start doing a lot of it more, and I start getting pretty good results.
Perfect. Perfect. Okay. The next one I probably should have asked for a little bit more elaboration on it, but maybe we can try to pick it apart. The question was, how should the family as a whole approach outside opinions?
And that's a tough one because, again, I always go back from my experience. Um, there can be a lot of negative thoughts when it comes to autism, because when I was going through it, it was a lonely time, because a lot of people, if I try to say, even therapists, when I try to tell them, my plan was for him to get better, someone told me that they've been doing that for many years and they've never seen anyone get better. So you can get very down, and then I have other people that said, "Oh, you don't accept your child as they are. You have to accept them as they are." And I really and it made me feel like, I don't love him because of how he is. But that was not the truth. It's because I love him was the reason I was giving it 100% of what I everything in me to help him to get the best life that he had. And sometimes I would look at him and I see, especially after about a year of biomedical, when he was more aware, I could see that he was not happy. He when he saw other children playing, I looked at, because if you have a child, I'm telling you this, and I know a lot of moms with autism will agree with me. If you have a child with, there's no one that knows their child more than a mother of a child with autism. I knew my son inside out, and I know most parents with children with autism. They know even just the breath. They know them very well. Um, and I would look at my son and he'd see other kids playing, and I know once he was aware, he wanted to play, he wanted to be involved, but he didn't know how. And I see just that little sadness on his face a little bit. And then when he did try and he didn't know how, so he'd go up to them and like right in their face and invade their space and smile, and he thought, and they back off because they were just like, what is weird kid. But so all those things I see, and then when he started school, he would try to talk to me, like he would tell me things, because he wanted to fit in. And this really took, because when he first started kindergarten, after he went to the autism school for 2 years. So when he left, when I took him out of the autism school for regular school, like first 2 weeks I had an aide with him, because I did not, I myself was wondering, would he be able to survive in the regular classroom setting, because in the school it was just it was a private Christian school, so they didn't have like a calm area, like I explained, when they have a meltdown at the autism school, they have a calm area, so you could go there and calm down. They don't have any of that in the regular school. So I was didn't know how he was gonna do. What if he starts screaming and down there's nothing? So I sent the aide with him the first week, and then the teacher told me, look, he wants to fit in. You see, he looks around, he's aware there's no one else that has an aide. He doesn't, so he was barely up, he doesn't want her beside him. You could say he just wants to fit in. So when I saw all those things, I know that he was not happy with himself, and I wanted to give him the best way to be confident in himself. So I would say the people that will say, oh, talk to you and not be supportive. Just surround yourself with people that are supportive and people that are on the same journey. I never really read any stories about, I mean, I know there are some people that kids that have not recovered, but I never read any of those stories when I was going through it. I only read the positive stories because I wanted to, or the recovery stories, because I wanted to keep myself motivated, because I needed to keep hope alive then. So that's what I would surround myself with, and I would treat this is my son, and I was trying to help him, and that's the direction and the path. So nothing anybody said to me was going to deter me from that, or make me feel down, or make me feel bad for trying to help my son. And I would say to anybody that's on this journey, just stay your course, know what you want for your child, and it doesn't matter what someone else say. If they're not with you, still keep on the journey and just surround yourself with positive for people.
Okay. So pretty much you just decided, whatever successful information you discovered, you would put your mental energy on those successful situations and just
Right.
kept your focus on that the whole time.
Yes.
All
Yes.
right. All right. Perfect. Perfect. Okay. I know last time when we talked, you did an amazing job of explaining the exorphins, the caseomorphins, the gluteomorphins, the soyomorphins. Can you break down red dyes in that same vein?
Yeah, so red dyes, well, based on what I researched, back in the day, the food dyes, they used to use like plant-based food dyes, to give food the color, and like the red or yellow or whatever. So they used to use plant-based food dyes. But they find that some of the plant-based food dyes, because you want to give the food vibrant, good, nice colors, some of the plant-based food dyes, as you know, they would fade, some have a taste to it, and they're more expensive. So they start using more of a petroleum-based synthetic dyes. And if you look at the research, a lot of these synthetic dyes, I mean, they're toxic to the body, and they do affect behavior. And a lot of times they talk about red 40 and yellow 5 and all those. And so those dyes that they use, and you have to be very careful because they're in just about everything. You look at, because it doesn't look that color on the container, like you're eating chips or whatever. You still have to read the label to see if there are dyes in it. Because if you have the so the let's break with that. I could probably cut out that little section because I lost my train of thought.
No, you're good. You're good.
What was I saying? So if you reading food labels, so it's essential to read food labels to see if they have red dyes, yellow dyes, or whatever dyes, because sometimes you look at the food and it does not. You wouldn't think it would have dyes because, say, for instance, salmon. You could look at the salmon and you say, "Oh, this meat," but a lot of times, if they're farm raised, then they will be white in color, and then they add the dyes in order to give it that pink color of salmon. So, and even fruits, sometimes they're dried fruits, and you look at it and say, "Oh, I'm eating fruit," but then again, you still have to read the label because the dried fruits, they could put the color on it to give it that vibrant color. Because when they dried, it doesn't look as pleasant. So everything, even when you're buying supplements, you have to read the label because some of the supplements also have that, and prescription medications, especially for children, may have color dyes. I was trying to find some ibuprofen at the store for my daughter because they play a lot of sports, and I could not find a ibuprofen without dyes. And then I did find one that says dye free kids. That was dye free, but then it has isosorbate 80, which is also toxic to the gut lining. So I ended up having to get the pharmacist to compound some for me. So everything that you're, whether you're buying fruits, dried fruits, whether you're buying meat, whether you're buying just processed stuff, you have to read the labels because all these dyes can cause, the literature shows, can cause behavior issues, anger, ADHD. And if you can really clean up, even yogurt, sometimes you have the yogurt and they have berry flavored, and the berries can be dyed. So you have to be very, very, very vigilant in reading labels in order to avoid the dyes. And even then, sometimes it doesn't say red 40, but there are other names that they have that you may see that on there. So you have to be familiar with all the names of the different dyes as well.
Okay, so basically, with similar to eating, we'll just use gluten free as an example. You could still pick a product that says gluten free, but it still has other exorphins in it that react in an adverse way. The same thing happens with the red dyes. They can get snuck in different areas that you may not be aware of if you don't really look at the label
Right.
very closely.
And
Okay,
I would say not just red dyes, all dyes, red
all
dyes, yellow
dyes.
dyes, and even cake, they have brown dyes. They have all sorts of dyes, and a lot of them are petroleum based. So I would say that I try to avoid processed foods in general because a lot of the processed foods, that's where you'll find a lot of the dyes. And even when I was going through it, and I advise my patient, just cut out the processed food because I don't, when I say gluten free, I do not really mean going to the store and getting a whole bunch of gluten free stuff because a lot of those are still processed. And if it says gluten free, it doesn't mean zero gluten. It means it has to have less than a certain amount of gluten in order to be labeled gluten free. So the objective is really not to go out there and buy all of these junk food that says gluten free. The objective is to go back to the days where you cook your food and you make your things yourself. That's the objective.
Okay, and so I know with the exorphins, the mechanism that was causing some of the behaviors is how that compound would bind with the opioid receptor and cause that issue. What what mechanism are the dyes doing that's causing the issue in that pathway?
Yeah, I know the dyes can affect. I mean, it's just toxic to the system, just like a lot of the food is toxic. if you think about petroleum and you think about, killing the gut microbiome, destroying the gut microbiome, affecting the brain, um, getting through, if you have leaky gut, sometimes leaky blood-brain barrier, getting into the nervous system and cause it behavior changes. So I can't say that I know the exact mechanism of action, or if they have it figured out whether it bind receptors, but it's just like you were going to get gas and swallow it. It's just toxic to the system, toxic to the gut microbiome, and toxic to the cells in general.
So it sounds like the petroleum is probably one of the big factors when you take something that toxic like petroleum and put it directly into the body. That's going to be the
Right. It's
adverse.
just
Got it.
exactly. It's just
Okay.
like glyphosate that's found in fertilizers and like Roundup, is toxic. It's toxic to the gut microbiome. So it's all those things are just toxic to the human body in general.
Okay. Okay. Perfect. Perfect. Last topic, heavy metals. In your experience and research, how do they get into the system? What issues do they cause, and what things can be done to either reverse it, clean it out of the system, or minimize that once you've detected it?
Yeah, so heavy metal has been a big thing, especially for autism. There's some people that do, even IV chelation for heavy metals for autism. And the first question you say, how do we get heavy metals into the system? I know when my son, when we were going through autism, his aluminum level was high. So how did that happen? I know we use a lot of and they're different heavy metals. We have the aluminum, we have mercury, we have arsenic, and when I checked the hair sample for heavy metals, some people are high in like arsenic. I find that people that eat a lot of rice, um, because rice absorb arsenic from the soil, they tend to have high arsenic levels. And then aluminum, people cook with aluminum pans, aluminum foil. They put a foil paper over their food when they're cooking. There's in deodorants, there's anti-caking agents. So and then some vaccines have aluminum, some vaccines have mercury. So when you add it all together, and then amalgam fillings. I mean, the sources are from the soil, from water. So the sources for different ones are there are many sources, and I've done several articles, and I'll give you Alex to put on the website. I've kind of broken down aluminum and arsenic and cadmium and sources for those. So you can get them. There's quite a few different places. Even lead, you could get lead from even toys that are tainted lead, old houses. So I have a good size article that you could put on the website that goes through all the different sources of exposure for heavy metals. And what I find just from my son and many patients is that the body doesn't want to hold on to heavy metals. Heavy metals normally try to hide in fatty tissue, and the brain is mostly fat. So I think a lot of it will go to the brain and cause a lot of those symptoms, but the body wants to get rid of it. So I find that once you start healing the gut microbiome, once you start detoxing the body after, first is to heal the gut microbiome, because I think if you heal the gut microbiome, that will help a lot. So I never really do IV chelation or anything. I find that once you start healing the gut, and they have done, to get into a little bit more details, so they have done studies where they had two, as I saw on PubMed, they had a wild type mouse, and then one that they gave antibiotic to wipe out the gut microbiome. So when they had the wipe out the gut microbiome, they fed both sets arsenic. And the one that they wiped out the gut microbiome with antibiotic, they found that they had a lot of arsenic in the blood, and they had a lot of symptoms of arsenic poisoning or toxicity. But the wild type one that they did not give the antibiotic, that had a good functioning gut microbiome, they find that they think that the bacteria swallowed all the arsenic and they pooped it out in the stool. So there was none in the blood. So the symptom was less. So I look at a lot of it the same way. If you have a good microbiome, then a lot of times it will help to detox some of that heavy metal. So what we do is we just give stuff like glutathione or lipoic acid, binders, things to help the body get rid of that, get rid of the heavy metals. And also we have to really, before starting a detox, so you have to optimize all the systems, put in all the different, nutrient deficiency, make sure the bowels are working, so that before you start detox. And hope that answered the question. So it's a process. It's a process. It's not like, oh, heavy metal, let me just go get heavy metal. We do it, we kind of treat the body as a whole, and then that's part of the process.
Perfect. Okay. All right. Let's end on that.